Again, we talked about communicating with empathy. A lot of that will also help with the behaviors that your person with dementia has. And if they're having less behaviors, it's less stress on you. Okay. Building a support network. I cannot stress how important this is. Coming to educational series, talking to people, coming to support groups, pushing yourself outside your comfort zone. Dr. Cummings does this thing when she does her talks where she stops in the middle of the talk and she makes everybody say hello to the person sitting next to them. Come on, we're going to do it. Say hello, introduce yourself. Now, what I want you to think about doing is maybe if you've seen that wife or that husband at multiple meetings, at the end of the next support group, at the end of this, go up to them and say, would you like to go out and have a cup of coffee sometime? It's hard at our age to make new friends. Everybody lives in their cute little houses and the cute little HOA neighborhoods, and they drive in, go right into their garage, and they go right into their house, and we don't talk to people. It's hard. But these are your people. They're here. They're all living and going through everything that you're living and going through. So reach out to them. Having that one person who you can actually talk to, who understands what you're going through. Because your neighbor who thinks Joe's doing great in Joe's grocery store for 10 minutes is not the person that you want to be having this conversation with. Does that make sense? So 2 to 3 people for specific scheduled tasks weekly. You've got to find people that you can help. Stop. If I hear one more family member say to me, well, my kids are busy, I can't ask them to help. Really? Did you change their diapers? Did you take them to soccer? I'm not saying you're going to move in and make them be 24/7 caregivers. But by all means, ask. Let them know how much you're struggling and how hard this is. It's not a failure on your part. This was never supposed to be your job in the first place. So ask for help. I had a patient tell me yesterday that they were flying back up to their north house, and they were trying to figure out how to get the car to the neighbors. It was like 4 minutes away. And then what would she do with the car? Could she leave the car there? She's going to be gone for a while. And the neighbor next door said, I'll drive you. It's only 4 minutes away. The amount of stress that alleviated from her, not having to worry about where she was going to put the car. Ask the neighbor. They don't mind, honestly. You run into Publix, can you grab me some milk? I ran out of toilet paper, right? That, you putting your loved one in the car and having to go to Walmart to buy toilet paper, when you see your neighbors going, ask for help. Ask. Okay. Community resources. Well, obviously, big promoter of Adult Day. And I bet nobody's surprised about that. And then respite care, right? We have to talk about respite care. And so for those of you who still have your loved ones at home, respite care, it can be one of two things. One is to move your loved one into a community for a short period of time. Most of the communities are doing 4 weeks. They really won't do less than 4 weeks. So some people will put them in for 4 weeks. Some people will pay for 4 weeks and maybe only use 2 weeks or 3 weeks. They might use a week to move their loved one in and get them settled and then go away for 2 weeks and then spend a week kind of getting their life back together before they bring their loved one back home. And so the 4 weeks actually goes by pretty quickly. The other way to provide respite for yourself is to bring care into the home. And so we have many of our families here who will go away for a week and they will have their loved one, maybe they come 2 days a week or 3 days a week, but the week that they're gone, they'll have their loved one come 5 days, and then they'll have somebody who picks them up, stays with them overnight, and brings them back in the morning. So that they're just paying for overnight care. And they can actually get away for 3 or 4 or 5 days And that respite for them can be exceptionally helpful in sort of recharging their batteries and being ready to come back into that caregiver role. So those are two ways to provide respite for yourself. And then, of course, there's the, Dr. Cummings jokes a lot about showing up with the suitcase and the hubby at your son's house and saying, here you go, he's all yours for the weekend. I'm out. And sometimes that works. Sometimes there is family members who can pinch hit for us and step in. And let me tell you, there's nothing better to teach your family about what the caregiver role feels like than to have them step into the role of caregiver for 24 or 48 hours. All right, good. Connect with peers. We talked about that, support groups. And you want to check in with each other. Once you find that person, get their phone number, text them every once in a while. How you doing? It feels good to have that person check in with you too. What's happening? How can we help each other? And then I'm a big proponent of bringing in professional help. Come see me. I'm here. I have 2 offices. I have one here. I have one on State Road 64. And I spend a lot of my time seeing caregivers, not just the patients with dementia. I feel a lot of times actually I work more for the caregivers than I do for the people with dementia. I can make much more of an impact if I help you stay healthy so that you can be a better caregiver. It doesn't have to be me. It can be any other psychiatric provider, even if it's a primary care who you could talk to and you think will understand what you're going through, but some professional who can help you along the path. Okay, I think I did a bunch of this already. Yep, I think we did a lot of this. Use respite care, call family and friends, reframing the decisions. Yep, asking is strength. Asking for help is strength. It is not failure. It is not weakness. It is recognizing what the problem is and finding a solution. Does that make sense? It is not failure. All right. Gosh, I talk ahead of myself, can you tell? Darn, I already talked about that. The dementia training, obviously, like classes like this, learning communication, safeties, routine, learning how to de-escalate when your loved one becomes agitated or starts wandering, those sorts of things. All of those things, again, are going to help you in terms of caregiver burden, right? Because nothing is harder than taking care of a dementia person who's actually agitated and irritable. It just raises the level of stress exponentially, right? So again, learning how to de-escalate those situations, learning how to validate them, learning how to, take that piece of the puzzle away will also help you in the end by decreasing your stress. One of the things that we don't talk about enough, and I do find myself in this situation a lot of times, is making sure that people have already done all of the legal and financial things that they need to do. I had a woman in here the other day who's 67 years old, her husband is 70, the house is in his name, she does not have POA for him, and she's beside herself. Like, how did you get here? How did nobody tell you that you needed a POA or that you needed some legal assistance as you watched him decline? But she didn't even have the diagnosis of dementia yet, and he was well into stage 5. Scored a 12 on his mental state exam. So probably for all of you with your loved ones where you are, should have been done. But if you can share that information with other people that you find on the journey who are earlier, in order to sign a power of attorney, you have to know the day, the date, the month, the year. You have to be able to explain to the attorney that you have capacity enough to choose, I want him to be my POA. If you can't say that in the attorney's office, they're not going to let you sign that piece of paper. If you wait too long, you're going to find yourself in a pickle. All right. Ongoing help and respite. And again, the adult day, home aids, respite breaks, I really haven't found great local agencies for helping with this kind of stuff, but I mean, there are some churches that do some volunteer work and things like that. So there are some groups that will provide respite, that sort of thing. But for the most part, it's paid, unfortunately. All right, here's the takeaways. You ready? You cannot do it all. Shocking, right? I know that's a huge revelation. It's challenging. You have to adjust and you have to change your expectations of what you're trying to do for yourself. Because we oftentimes are the biggest ones who set ourselves up for failure by expecting ourselves to be able to do too much. This is a finite period of time. Most of my patients that are in stage 5 and stage 6 of dementia have between 2 to 3 years to live. This is not going to be the rest of your life. So adjust your expectations for that period of time. Act early on the strain. Watch for the irritability. Watch for the decreased sleep before you start having worsening of your own chronic health issues. You want to try to catch it as early as you can and ask for that help that you need. Okay? And health of caregiving helps both of you, right? It protects you both. Rest, nutrition, medical visits, breaks, and that calm communication, that empathy, and those clear boundaries will just make life easier for you. And know when to ask for more help, right? Use respite, adult day, or home aids to reset. Questions? Mm-hmm. Mm-hmm. Absolutely. So the question is respite confusing for the person with dementia? It is. The thing that's positive about it is that most of the patients that are at stage 5 and stage 6 have very short-term memory. So oftentimes within 3 to 4 days of moving into a respite situation, it becomes their new normal. And so they adjust relatively quickly. The other thing that we oftentimes will tell families to do is to bring items from home that look familiar so that they have something that they can identify with. A lot of times I tell families, take the sheets off the bed. Don't wash them. They've slept in them. They smell like their house. They smell like them. Put those sheets back on the bed at the respite center. Same thing with a pillow, a blanket, a comfy chair. Most places when you go into respite, they furnish you with the bed and the dresser. You can bring a couple of things in, some pictures from home, things that are comfortable for them. So yes, it's not ideal for the person with dementia, but it's also not ideal for the caregiver to have themselves so burnt out that they're yelling at their loved one or leaving them unattended or risking their own health. So it's not the worst of the two evils. Respite care is better for you to be able to recharge. Now, some people come back after respite and say, I can't do this. I cannot bring my loved one home again because now they've had 3 or 4 weeks where they don't. And during that 3 or 4 weeks, because one of the biggest fears I hear from family members all the time is, well, he's not going to like it there. He's not going to want to go. We hear that about Town Square all the time. And then they go and they settle in and they're fine. And you're like, well, look at that. And so that fear of, so a lot of times long-term placement starts with respite. And then I have plenty of other times where people will put their loved one in respite for 3 or 4 weeks and then come back and take them home and they are recharged and refreshed, and they may then ask for more resources. That may be when they start adding in some more additional in-home care or pick up an extra day at Town Square. But it's definitely something that we encourage everyone to do here, is to utilize the days here at Town Square. If you're struggling with your loved one and they're only coming to Town Square 2 days a week, they need to come 3, 4, 5. Don't move them into a memory care unit until you've maximized your options for respite during the day. I had one woman who went from 4 days to 5 days, and she was like, it changed everything for her. It completely lightened up her load, and she was able to survive the weekends just fine, and she lasted another 3 or 4 months before she eventually had to go to hospital. So utilize that time. It's much less expensive than placing them in a facility. And the 8 hours of the 16 hours that you guys have them, they should be sleeping. I mean, a lot of them want to go home and go to sleep right after they get out of here because they're tired. So sometimes they're sleeping 10, 12 hours, that kind of thing. So you can get through the weekend together. So pretty much everybody who is Town Square folks or patients with dementia who need 24/7 surveillance are really memory care material. You have to remember, in the assisted living, you have to still be able to do quite a few things for yourself. So there's assistance, right? They're going to bring you your medication. They might prompt you to go down for meals. But most people who live in an assisted living still have the ability to know what they want to do. They can pick an activity. They still have some cognition. They're not good to be living by themselves, but they're still able to do those things. So correct. Right. Nope. Nope. Especially in AL, they really can't do that. In memory care, it's a little bit easier for them because it depends on memory care. But the good memory cares will go and make sure everybody's up at the same time in the morning, right? Everybody gets up. And if they don't want to get up, they go away and they come back 5 minutes later and they get them up. And once they get into that routine, now there are a lot of facilities where the caregivers will go in and say, oh, she didn't want to get up. And that's it. That's the end of the story. But in the good facilities, they will coax them and get them up and get them into that routine. And once they get them into that routine, it becomes much easier for them. And so you're right, they can't force them to take their medication. But again, a lot of it is approach. A lot of it is approach. And sometimes it needs to be reapproach. Sometimes they don't want to do it that moment. They're a little persnickety. They need a couple M&Ms. And then we can try it again. And they'll actually take their meds, right? So we have to think outside the box. We have to figure out how to get the person with dementia to be able to do those things. And again, depending on the level of care and the facility that you choose, you'll see a difference with that. Yeah.
I'm having a hard time with traveling, I'm on vacation, and he didn't want to watch them while
See, that's where using the money that you would spend on. I mean, I think respite now is running between $7,000 or $8,000 a month. So you could go on a vacation very easily if Dad came here 5 days a week, because we're basically about $18 an hour if you come 5 days a week, and then you have somebody pick him up, stay with him overnight, and then drop him off in the morning. The only thing you really have to cover full time then is over the weekend, and you should be able to.
right now, yeah, I had a before all these
Mm-hmm. Yep. Yeah. And that's the asking the family. Perfect. That's perfect. Right. Did everybody hear that? She's asking her son, asking family. But I also think that that's part of it too, is that if there's sort of an expectation that this is part of your job is to help me take care of Dad or Grandpa or whoever, right? I think we have to not ask so timidly. We have to have more of an expectation, right? Any other questions, thoughts? Mm-hmm. Mm. Yeah. Right. Mm. Mm, no. Yeah, I've had a lot of, yeah, right, right, right. So again, just to repeat for everybody, if you could hear, she's in a relationship. He doesn't have any paperwork, no POA. She's his primary caregiver, and he's declining, and she feels stuck. And that's, no, because people with dementia don't have the ability to reason. They don't have the ability to see that they're cognitively impaired. I've this one gentleman who's 90 years old. He's in a wheelchair. And every single time I go see him, he says to me, well, I don't know why I'm here. My wife could take care of me at home. Everybody here is in a wheelchair. I'm like, Stan, you're in a wheelchair. Cannot see it. It's, he just cannot see that he's anything like the people that they're all old here. Stan, you're 90. I mean, they're all old here. So and people say that to me all the time too about, oh, I took my loved one to see an assisted living facility. That to me, okay, you ready for the analogy on that? Do you ever take your child to the pediatrician and say, show him the shot he's going to get next week when he shows up? Would you do that? Mm-mm. Does he have children? He doesn't have children? Anything to do with it? Yeah. Yeah. I don't know enough about your situation to honestly advise you. I'd need to see him to understand where he's at in the disease process in order to be able to advise you as to what your options are. Right. But if you can't get him to go, again, and then a lot of that falls back on my knowledge and understanding of medications, because when people have dementia, they're anxious and they're depressed. I use the analogy all the time. I know you've all heard me use it about it's just like renting a car. We all drive our cars. We drive perfectly fine in our car. We don't even think about it. I was on vacation last week up in Rhode Island. I got into that Grand Wagoneer and thought, I don't even know how to turn this thing on. I have no idea where the flashers are. I have no idea how to adjust the mirrors. And I got to drive out onto the road and put my life in danger. I was anxious right up to here. That's the way dementia patients feel every single day. Every information that comes into their brain is challenging for them. And so they want to do very little. They want to have their world very small. They don't want to go places. They don't want to do things because they don't want to be challenged because they're struggling alone. You get all of that treated with the appropriate medication, which many of your loved ones are, and you see the difference. You see that they're able to relax and be able to enjoy life a little bit better. This is a terminal illness. It is not going to last for forever. And so if we can make them comfortable, then a lot of the decisions that you need to make will become easier for you. Well, but again, there are people in this room whose loved ones are in facilities. They don't let go. They're still responsible. They still go. They still care for that person. They just don't take the 24/7 responsibility. Bobby? No, assisted living is not locked down. And so if he doesn't want to be there, that's the problem. And a lot of times I think it's very interesting when they say, well, he's not ready for memory care. Okay. Is somebody with initials after their last name saying that? Or is it, the people at the assisted living facility? Like, is there a professional who has evaluated your loved one to say what they need in terms of memory care? And then there are different levels of memory care. I have one facility I go to in Lakewood Ranch has 3 neighborhoods. And as you decline, they move you to a different neighborhood. So our higher functioning residents are in one neighborhood, and then our middle is in the second, and then are very low functioning, people who can't, feed themselves and need assistance getting in and out of their wheelchairs, and who need the highest level of care in that third level. Because the people that are the higher functioning ones, they don't want to be in the same facility with the people that are in that third. I mean, I can't even get Stan to understand that he's in a wheelchair and he's 90 and he needs to be there, right? But when they have to look around at other people, they're always talking about the old people, right? Yes. Yep. The old people. Yep. Right. That ability to see it. He'll never recognize it. It's not like he's ever going to come to you and say, hey, thanks for putting me in an assisted living facility. I really needed it. Never going to happen. Never going to happen. Again, it's just like we make those decisions for our children as we raise them, right? They're not decisions they want. We don't tell them we're going to take your bag of Halloween candy away the night of Halloween and they're happy about it. But if we left it with them, do they have the judgment and insight to know they can't eat 15 pieces and not get sick? We make those choices for them. And that's what happens as your loved one declines cognitively. You're going to have to make decisions for that person, regardless of whether or not they want it or not. So the idea that you can take them to go look at the assisted living facility, yeah, it's not going to work. Anybody else? All right. Thanks for coming. You're welcome. I'm good. I'm good. How are you?
I have finished writing my book, but I can't find anybody locally to print it, and they go up to Minneapolis. Who are you having published?
So Dr. Cummings, who is the gerontologist, she has the Dementia Association LLC, and she has somebody who she uses to publish. So she's going to help me publish the book. So
You got off easy.
I did. You're welcome.
Jack's about the same, just pain in the neck. Lily White.
I saw it. Did you really? Yeah, I was there today.
Yeah, so
Yeah.
what did you think?
It's all, I'm trying to figure out how to turn this off. I don't want to have this conversation on here, but you think I would know how to do this? I think that's it. So